Hello, my name is Haley Posey. This is my instructional speech. Today I'm going to be showing you how to draw blood. Drawing blood is important to me because I do it every day, Monday through Friday for the great old Navy. So today this is my patient, H.N. Calvo. I'm going to be showing you how to do a arm stick and then as well as a hand stick. So to start off, we would make sure we have like the correct patient identifiers. We normally have labels, but since she's just a random volunteer, we're not going to have any of those. So the first thing you want to do is put on a pair of gloves. And then we have these blue things, which are called tourniquets. They help cause pressure above the vein, so you're going to put it about 3 to 4 inches from where you're going to stick. You just tie it. I'm going to ask my patient to make a fist. Go make a fist. Now you're going to feel for a good vein. A vein is going to be something that's bouncy and it bounces back at you. A tendon is going to be something very hard that doesn't bounce back. You can kind of feel the difference. You learn as you go. So she has 2 very good veins right here. I'm going to go for this one because it's a little bit closer to me. So then you clean it with alcohol and you want to wipe in a circle so that way you take the dirt and you're wiping it away from the site about 1 to 2 inches. So we have 2 different needles. I'm going to take this off of you so it doesn't make you go numb. So we have 2 different needles. We have a butterfly needle and then we have a straight needle. Butterfly needles are easier when you're drawing multiple tubes on a patient. So if you have 3, 4, maybe sometimes even 10 tubes, you'd use a butterfly needle. This is a straight needle, so the green cap is where the needle is, the white cap is where we attach a vacutainer. So what the vacutainer does is it causes a suction stimulation, so that way you can attach the tube and the blood sucks into the tube. And the tubes already have pressure in there to cause the suction process to go. So now I'm just going to make sure I have my tube, and then I'm going to grab some gauze for after. Alright, so now that I'm ready to go, I'm going to go ahead and tie the tourniquet again, 3 to 4 inches. My patient's going to make a fist again. I already cleaned her off, so I'm not going to go back and touch the site and dirty it up. We uncap the needle. You're going to taut the skin with the thumb, and then you're going to go in at a 15 to 30 degree angle. It doesn't really matter the way you hold the needle. And then as you can see the blood flow, you pop the tourniquet off about halfway when the tube is full. You'll take off the tube and then blood pressure. And then you make sure your needles goes in the sharps right away. And then afterwards you would wrap up your patient ribbon. And this was just going to stay on for about 5 to 10 minutes. It just helps the blood clot so that way our patient doesn't bleed out of the site, because you did just create a hole in their vein. So next I'm going to show you a hand stick. Can you take off your watch for me? So for a hand stick we would use the different needle, which is the butterfly needle. So when you look at butterfly needles, there's 2 different kinds. One is green and one is blue. The difference is the gauge of a needle. The bigger the gauge, the bigger the needle. So a 21 gauge is going to be for someone who has thicker veins, and then the 23 gauge is going to be for someone where we're going to stick them in the hand with smaller veins. Sorry for my hand. Not very good at these ones. So again, we're going to tie the tourniquet 3 to 4 inches. Now for the hand, it's a little different. You're going to ask them to make 3 pumps of a fist. And then you're going to ask them to web out their hand on the edge of the seat. Then relax your wrist a little bit. Perfect. So she has a good one in the middle of her hand. For the hand, you feel more tendons than you do veins. Just like, unlike the arm, you'll feel more veins than you do tendons. Just because our hands have lots of different muscles and tendons in there. But the same thing, as long as the vein is popping back at me, then we know it's a good vein to stick. So with the butterfly needle, it's a little different than the straight. So it looks like this. So this is where the vacutainer goes, our little suction vacuum. This is the tube which the blood will flow down. And then these are what makes it called a butterfly needle. These are the wings. So you go ahead and uncap your needle. And for a hand stick, it's very important to pull taut on the skin to anchor the vein because the veins in the hands move very easily. You're gonna go ahead and insert. And then you would attach the tube and the blood would flow. And then you always make sure you have gauze. Pull out, collapse the needle, and then she'll apply pressure. And that is it. Thank you.